Good afternoon, ladies and gentlemen. This is Markus Rudolf from WHU Otto Beisheim School of Management. And I was told that we are waiting for another 3 to 4 minutes because we have quite a significant number of people who are waiting in the waiting room. And obviously it takes a couple of seconds until everybody has been admitted. If I see that correctly, we currently have more than 300 people in the chat at the moment, but there are other people waiting. So I would wait until 4:05, if you don't mind, and then start with the presentation, which you probably can already see on your screens. All right, ladies and gentlemen, I would say we start. Let me first of all thank you all for attending. It is really many people here in this chat about a topic which is very relevant at the moment, not only for an economist like I am, but also for everybody here in the country and probably in Europe as a whole. And what I would like to share with you this afternoon is a couple of thoughts about the development of about the development of Corona numbers, because that has a very important and significant impact and implications for the economic prosperity of this country and for the rest of the continent. And on the other hand, it is also a mathematical task which can be solved with econometric and mathematical methodologies. And I would like to basically share our thoughts, my thoughts about the coronavirus development with all of you that you're attending here. Now, let me very briefly show you what the agenda is. I would like to firstly show you what kind of measures can be taken in order to ban a crisis like this one, namely a virus crisis. I would like to also show you the status quo as of not 4th of April. I've updated the numbers today. In other words, I can provide you with numbers which are accurate until 5th of April midnight. And then I would like to provide you with some statistical modeling which allows us to draw some conclusion or at least hypothesis about the duration of the whole process that we are going through. So let me firstly start with the two different approaches. When always you deal with such a crisis, such a virus crisis, you are dealing with exponential numbers, and this is the challenge. So in other words, if the growth rate, for instance, of new infections every day grows by 1.3, this means that within a month, the growth rate grows by 1.3 to the power, raised to the power of 30. And this is the reason why you get incredibly large numbers very, very quickly. So basically what you can do is you can cope with two different strategies. One strategy is the Chinese strategy, where you apply a complete lockdown of areas of the countries so that the virus cannot spread anymore. And the hope is that the virus spreading is completely going to be drying out after a couple of weeks. The other opportunity is the strategy that Korea was following, namely an isolation strategy, where you isolate those people who have been proven to be infected by the coronavirus and separate those people from the rest of the population. And you would hope then that you would be able to ban the further spreading of the virus. The advantage of strategy number two is, of course, that an economic shutdown is not necessary, because everybody who is not infected yet can still go to work and can keep the economy running. The disadvantage of the Korean strategy, however, is that you are not able to really get all of the people who are infected by the virus, because you have many people without any symptoms bearing the virus within them nevertheless. And secondly, it is virtually impossible to test all people in a country or in an economy. So therefore, the Korean approach has on the positive side a better economic prosperity, on the negative side a higher risk that the virus is going to spread around faster. The Chinese approach basically locked down the entire economy in the entire country, And the effect was and is that the number of newly infected people and also the number of deaths per day due to the corona crisis beyond a certain point went significantly down. This is the advantage. So in other words, you're really covering all people who might potentially be infected by the virus. On the other hand, there is a complete economic shutdown, which means that you have very severe economic effects. So those are the two strategies that you can apply. And what I would like to show you is how the development was. If you look at those charts, and typically my data source is this website, www.worldometer.info, where you'll find a very rich data set, and you can download it at any every day and at any time during the day. What you can see here is on the very top left corner, the development in the United States. And if you compare that to Italy, which is right next to the chart of the United States, then you see a clear difference. Namely, we do have an exponential development of newly infected people in the United States until today, whereas in Italy, we did have an exponential development maybe until the 20th of March, 25th of March, and since then we have a constant development of new infections. And the reason is that Italy basically took measures, basically lockdown measures against the spreading of the virus already as soon as March 9th, whereas in the United States it simply took longer until rigorous measures have been implemented. A very similar picture is the picture if you look at Spain, where you also have a constant development at the moment of new infections. In other words, no exponential development in the number of new infections anymore, but a constant number of new infections. You have Germany here in the second row at the very left, where you, if you look at the data, can have the hypothesis that new infections are not exponentially going up anymore. Again, that deviates very significantly from the situation that we are currently observing in the UK, which is here, right? In the UK, we still have that exponential trend. In other words, numbers are going down without any interruption in the UK at the moment. And then we have China, and as you can see in China, numbers went initially exponentially up and then they went down. Then you have that big bar here where basically a change in the measurement technique did take place, but at least at the moment in China, at least as far as it is reported, we don't have high infection numbers anymore. We need to know that China is probably roughly 2 months ahead of Europe. So in other words, the lockdown measures in China have been implemented as early as end of January, whereas in Europe and most countries it was mid-March to end March. Now here you have a couple of other countries. So this is Switzerland, for instance, a very similar situation to Italy, Germany and Spain. So in other words, that is the European approach. This chart here refers to Austria, and you might have remembered and noticed that Austria was a week earlier than Germany. So the lockdown of the economy did take place already effective on March 17th, which is exactly 1 week earlier than Germany. And even though we don't have a clear trend yet, but the hypothesis that new infection numbers are not only stable anymore, but even going down is something which is defendable at least. Here we have the Korean approach, and as I've said earlier, Korea, unlike China, did not use the lockdown strategy. It rather was using an isolation strategy where everybody who was infected and the nearest contact persons to that person have been very rigorously isolated. And as you can see, the success in the numbers of South Korea is comparable to what we had in China. I mean, when this all is going to be over, we will see where the economic prosperity was supported better with the lockdown strategy or with the isolation strategy. This is something that we will see in the future. And then finally, we have Sweden. As you might know, Sweden basically did not take any lockdown measures at all so far. If you follow the media, it seems to be the case that Sweden is about to change its strategy as well. But what you can see is that you do have an exponentially number of new an exponentially growing number of new infections every day. And when you model that, this is something that you will see afterwards. You will have a situation where the virus cannot be extracted from the society anymore. Now, one thing is the number of new infections. Another thing is the number of deaths. And probably from a statistical point of view, the number of deaths is more reliable because the number of new infections depends on the number of tests which are performed in a specific environment. And this differs very, very significantly. Korea has tested extensively. Germany belongs to the countries who is testing very extensively as well. Other countries are testing significantly less. So in other words, the number of infections that we have from the tests does not necessarily reflect the number of infections which there really are in a society. So therefore, the number of deaths is probably a more reliable indicator about the spreading of the coronavirus in a specific environment. And what you can see is still that in the United States, not only the number of infections is exponentially growing, but also the number of deaths. If you compare that to Italy, we have a very high level of deaths every day, but since 10 or 15 days, we observe that the number of deaths is not growing anymore. It is stable at between 500 and 800 cases per day. Very similarly in Spain and also in Germany, we already seem to see some effect. We don't see any effect in the United Kingdom. Just the opposite is the case. The number of deaths is still exponentially growing. This chart is the China chart, where not only the number of infections has gone down very significantly, but also the number of deaths has gone down to almost zero, roughly 60 days after the lockdown has been implemented in China. And here we have Switzerland, very similarly to other continental European countries. Then Austria, if you look at that chart, you might again have the hypothesis that Austria is already one step further than other European countries. The lockdown was earlier. We have South Korea, where we have a stable number of deaths since a couple of weeks already. And here we have Sweden, where not only the number of infections is exponentially growing, but also the number of deaths is exponentially growing. Now, if you look at that data, you can then try to take this data and model the development for the future. Let's start with Germany first. In Germany, the lockdown was implemented on March 23rd. Bavaria was 3 days earlier, and Saxony was also 3 days earlier. But the overall lockdown in Germany did take place on Monday, March 23rd. And what you can see here in the upper left chart is the average growth rate of newly infected people per day. So in the very beginning, in the early March days, it was so that the number of people who were infected grew by almost 50% every day. And what you can see is, at least since March 23rd, that the growth numbers of new infections is going down. Today we are here where the red line really is, and what you can see is that the number of new infections is almost not growing anymore. It is almost at the turning point from positive growth numbers to negative growth numbers. In other words, what we can expect for Germany over the next couple of days and weeks is that the number of infections will still be positive, but the number of infections will be smaller than in the previous days. In other words, we will have less infections every day compared to the previous days. At the moment, we are around 6,000 to 7,000 new infections in Germany based on the tests that we do. We can expect that this number will go down very, very quickly over the next 2 weeks, which, by the way, is reflected also by the doubling speed of the number of infected people in days. This is one of the figures that politicians, including the German Chancellor Angela Merkel is very frequently using. At the moment, if we take the average over the last 10 days of the doubling speed, we have a doubling speed which is around 8 to 10 at the moment. In other words, the number of infected people doubles every 8 days. This was around 2 in the very beginning of the crisis. In other words, the doubling speed was 2 days in the beginning, now it's 8 days. What politicians tend to say in these days, even though it's not a clear picture yet, is that we need to have 13 to 14 days of doubling speed until we can think about neutralizing some of the corona lockdown measures. Now, another thing is a very serious thing. I mean, what we do see is at the moment that we have in Germany around 150 deaths every day based on corona infections. And the number of deaths is an indicator which comes later than the number of infections. In other words, if the infections go up, then maybe 7 to 10 days later, we observe also a growing number of deaths. Now, if you extrapolate that, so today we are here between 150 and 200 deaths every day. If you extrapolate that, then you can conclude that the maximum number of deaths per day has not yet been achieved, has not yet been reached. So we can expect that the number of deaths per day goes up until a level of 250, maybe until mid of April. And then there will still be people dying based on corona infections. But after April 15th, we can expect that the number of dying people based on corona infections will go down slowly but steadily. And this chart here, what you see here in the second row at the very left, is a chart which tells you how many deaths we have in comparison to the number of infections 10 days ago. In other words, if the number of infections is 1,000, how many people will die within the next 10 days? And that is in Germany, which at the moment around 0.4%. In other words, around 0.4% of those people who have been infected 10 days earlier die. This is a very low number, which does not necessarily mean that in Germany there are less people who die, but it probably means that in Germany there are more people who are tested. So if you summarize that, then if you look at this chart here, then we can expect that the number of new deaths will be down to 0, not before the 22nd of May. So in other words, if nobody is dying from the coronavirus anymore, then we can assume that the coronavirus is not in the society anymore, because everybody has been infected and then finally people die or get healthy again. So this will last until the 22nd of May. So in other words, until the 22nd of May, we can expect, at least if we still, if we keep drastic measures to bend the spreading of the virus, then it is possible to have 0 new deaths until the 22nd of May. And by the way, no infections anymore until the 7th of May, which is another 6 to 7 weeks ahead of now. So in other words, we are talking about 6 to 7 weeks from now until the virus has been excluded from the economy. If we relax the lockdown measures, or if we do not alternatively find equally effective measures but smarter measures which bend the spreading of the virus, then, and this is going to be seen on the next slide, then infection numbers will go back to go exponentially up. So if we would have no lockdown measures, so in other words, if we would completely abandon the lockdown measures today, then you can clearly see that the growth rate goes back to 40 to 50% every day. And you can see here that the number of people who are dying per day because of a coronavirus infection very quickly increases from currently 150 per day to 1,000 per day and more. So in other words, relaxing or abandoning the lockdown measures is basically not an option, because we would have such an immensely fast spreading of the virus that the healthcare system, even of Germany, which has a comparatively powerful healthcare system, as we in these days observe, if we loosen or if we relax or if we abandon those measures, we will go back to an exponential growth of infection numbers very, very quickly. In other words, no measures is definitely not an option. What might people think about until the Easter break is over, or what people should think about until the Easter break is over, is whether there are smarter and better ways to ban the virus than just a lockdown. However, we need to have alternative measures if we abandon the lockdown in order to limit the spreading of the virus, and that is very, very, very important. So Germany without a lockdown is definitely not an option. We need measures. If not a lockdown, then something else, maybe something which Korea is applying, but nevertheless, we cannot go back to normal until the virus has been significantly limited in the society. Now, I have done now the same analysis for all of the other countries. So if you look at Switzerland, for instance, exactly the same chart, what you can see is that the growth speed of new infections goes down in Switzerland as well. The lockdown in Switzerland did take place on March 19th, in other words, 4 days earlier than in Germany. What you can see is that the doubling speeds of new infections goes up very significantly. But what you also can see is that the number of deaths per day still will go up for a couple of days before we basically have a turning point and the number of deaths will go down. The 0 new deaths day in Switzerland, according to that little model, will be on the 12th of May. And the 0 new infections will be on the 25th of April. The total deaths by then, by the way, will be 2008 in Switzerland. This morning, 715 have been recorded. And by the way, I can comparatively easily also, if I go back quickly, calculate the number for Germany. In Germany, we have currently 1,584 death cases. And according to the model, we will have to expect that the number of deaths due to the corona crisis will increase until a level of 7,400, So again, in Switzerland, we expect 2,000 deaths until the end of May or the middle of May, when the number of infections has become so low that no death cases are expected anymore. Then Italy, the country which was most severely hit so far, you see a clear going down of the numbers. So the growth rate of the new infections goes clearly and linearly down. We are meanwhile in Italy on a negative level. In other words, we have less infections every day. We still have new infections, but less than on the day before. And given that Italy was probably 2 weeks earlier with the lockdown, we can expect that if the lockdown is not going to be relaxed, that the shrinking in new infections goes on in Italy, and on the other hand, also the doubling speed in days will go very significantly up. In Italy, we still have the case, of course, that we have an immense number of death cases. So at the moment, I guess at the peak, we did have almost 900 deaths in just 1 day. In Italy, it seems to be the case that we are beyond the peak already, but still the death numbers are more than 500, so very, very significantly. And we can expect that the number of deaths will go down until May 22nd. On May 22nd, if nothing is going to be changed about the lockdown measures, we can expect that no new deaths are coming anymore due to the coronavirus crisis. 0 infections we would expect on the 6th of May, and the total deaths will sum up, according to this model, to 25,000. Currently, we are at the level of around 16,000. In other words, another 9,000 deaths are expected in Italy until the 22nd of May, when the coronavirus crisis will be over. By the way, what I've also calculated here is the number of intense care patients. So the assumption is that 5% of everybody who is infected needs intense care, because this is one of the limitational factors, especially in Italy. We did have less intense care beds in Italy than would have been needed in order to treat all of the infected people with a significant status in their infection. So now that in Italy, on the highest date, on the highest level, which was already on the 1st of April, 3,743 beds would have been needed. They are not there at the moment. In Germany, it's around 4,000 beds. Also, they are probably available. Now, next country is Spain. Again, the same development in Spain. In other words, the growth rate of new infections goes down, the doubling speed of new infections goes up, and the number of deaths per day, the maximum has either been reached or is going to be reached by the mid of April, of April. So then the numbers will go down according to the model. And the day when 0 deaths can be expected will be on the 14th of May, and 0 new infections are expected on the 25th of April, which means that in Spain we would expect 32,000 deaths by 14th of May, which is another 20,000 more than we currently have. Then Austria is the continental European country which did the lockdown probably the earliest, namely on the 17th of March, already the 16th of March, as it is indicated here already. And what you can see is that 0 new deaths can be expected on the 7th of May. In other words, earlier than in all of the other countries. 0 new infections on the 27th of April, 26th of April, and the total number of deaths is expected to be around 500 by the end of the whole crisis. 168 is the current level. Now, we can do that, of course, with all countries, and now the very severe development is something that we observe for the UK and the United States of America. Both countries have implemented lockdown measures comparatively late. In the United States, it is still so that many states don't even have lockdown measures. Of course, in the hotspots, especially in New York City and Washington, we do have very significant lockdown measures meanwhile. And what we also see is that the number of new infections is going down. But given that the lockdown measures have been implemented significantly later than in the continental European countries, we see that the number of deaths is expected to go up until end of April, until the end of April, where we would expect more than 10,000 deaths in just one day in the United States of America. 0 new deaths can be expected on the 9th of June, 0 new infections on the 21st of May, and altogether, and this is a really horrible result of that statistical analysis, is that the total number of deaths in the United States, because of the exponential developments in death numbers, both death numbers and infection numbers, the total number of deaths is expected to be more than 300,000 once the crisis is going to be over. At the moment, we are around 10,000. In other words, we have a very significant way to go in the United States, and it's not very much better in the United Kingdom. Again, the United Kingdom was comparatively late with lockdown measures or with alternative measures, which are maybe smarter from the viewpoint of the economy. But at least in the UK, as you can see here, we still have very significant growth numbers in the number of new infections. So while in Italy, the number of new infections goes down every day, in the UK, it's still growing with a speed of around 10% every day, which results, of course, in more deaths 10 days after the infection has taken place. And that means that the death number can expect it to go up until 4,000 a day, which will take place a little bit before the April is over. So maybe in the last week of April, the maximum and the number of deaths can be expected for the UK. And if you accumulate that, if you accumulate all of the deaths per day until the 13th of June, when no new deaths are expected anymore, the sum of the total deaths is going to be more than 100,000 deaths in the UK, which is a very horrible number, and which is based on the assumption that the lockdown is consequently implemented also in the UK until then. So in other words, if you look at the different countries, Sweden is a very interesting example, because Sweden was going a completely different strategy. So Sweden basically was building upon the responsibility of the people. So that means lockdown measures have not been implemented. People have not been prohibited to do their business and to walk around outside. And the idea was that people are responsible enough to make sure that social distance is going to be kept. But as you can see here in these numbers, this doesn't seem to be a very successful strategy. In Sweden, we still have very positive growth rates in the number of new infections. As you can see here, still around 15% every day, which of course results in an exponentially growing number of deaths 10 days later. So in other words, if Sweden is not changing its strategy to build upon responsibility of the people only, then we will never see a turning point in the number of deaths. It will exponentially go up. And the number of death cases in Sweden will be absolutely immense. It is therefore essential, at least according to my point of view, that countermeasures are taken not only in continental Europe, but also in Sweden. Absolutely essential. And what we have learned from the crisis is that each day really counts. The earlier you are, the lower is the number of deaths by the end of the crisis. If you gain 3 days and you're 3 days earlier, you have a significant lower number of deaths in comparison to some country which was 3 days later. So this is very, very important. The earlier you are, the lower are the negative consequences, the milder are the negative consequences. And finally, if you look at the Chinese example, the Chinese strategy was basically to extract the virus from the society, which is one approach that you could go, right? Another strategy is basically to let the virus basically spread into the entire society until a medicine or a vaccine has been found so that you can fight the virus. However, we know that medical treatment will be possible probably not this year anymore. Now, given the exponential development in the number of newly infected people, it is so that within 40 or 50 days, the entire country would be infected. Now, what we do not know is exactly what the number of deaths really is. But what we do know is that if the entire country is going to be infected, that the healthcare system of none of the countries will be able to deal with it. In other words, there will be people who are dying outside hospitals, at home or on the streets. And this is the reason why no lockdown measures is not a suitable strategy, because that will lead to a catastrophe. So what China has done is they basically tried to extract the virus from the society with very rigorous measures. This is true, absolutely rigorous measures. But the lockdown measures in Wuhan have been implemented on the 23rd of January, and 56 days later, those lockdown measures have been abandoned. In other words, we're talking about 56 days. Now, if you refer that to Germany, which has implemented lockdown measures on the 23rd of March, and if you go 56 days forward, then we are around the 20th of May, which is exactly the date where the model estimates that no new deaths will be observed anymore. So in other words, we will have, if we implement a strategy which has the goal to extract the virus from the society, at least for the time being, then this needs roughly 60 days, in other words, until mid of May or end of May. This is probably the due day. End of May is the due day. Well, another question is lockdown the only smart strategy? And it is definitely so that there are better strategies, or that there are other strategies which should be considered. It is, however, absolutely clear that we cannot allow the virus to spread until the end of May. And by the way, even by the end of May, and if I say the virus will be extracted from the society, then this is only partially true. I mean, it might be possible to ban the virus to such low numbers that we can go back to the situation which we had in January. And if we would have followed each individual case very rigorously in January, then the spreading could have been prevented. In other words, what we need to do is basically we need to basically make sure that the virus is not spreading, that the virus is extracted from the economies and from the societies, and after that we will still not go back to normal. I'm absolutely sure that mass events are not taking place for the rest of the year, or to put it more accurately, mass events are not taking place as long as we don't have a medical treatment against the virus, which is not going to be expected before the year is over. Now, let me summarize. What are the key results? If you go through that little simulation country by country, what you observe, and I'm starting with Germany here, the maximum number of deaths per day is expected to be in the mid of April 256, which is 100 more than right now. We already have been at a level of 180. I would expect that this number continues to go up based on the infections that we are already aware of. The number of deaths is going to be 7,400 in Germany, and the new deaths level down to 0 is expected on the 22nd of May. Since March 5th, we have a comparatively small growth rate in the number of infections. And what you also can see is that the average death rate compared to the number of infections in Germany is only 0.3%. If you compare that to the UK, for instance, which is on the next slide, compare that to the UK, there the death rate is 4%, which does not necessarily mean that the people in Britain die easier from the coronavirus. It probably means that in Germany we have significantly more tests. So Germany, I would expect the total number of deaths 7,400, and that the whole thing is going to be over by the 22nd of May. In Switzerland, 12th of May, and altogether 2,008 deaths. In Italy, I would expect that the total number of deaths accumulates to 25,000, and that the last case where somebody dies from the coronavirus will take place on the 22nd of May, as in Germany. In Spain, this is Spain, the curve goes down until the 14th of May, and by then we will have more than 30,000 people died based on or caused by the coronavirus. In the United States, this is a very sad number because countermeasures have been taken so extremely late. That means that the number of deaths per day will continue to grow for a couple of weeks. And that means that the total number of deaths in America is expected to be more than 300,000. And if the countermeasures are now implemented rigorously, we can expect that the virus is extracted from the society in the United States by June 9th. It's not better in the UK. Again, in the UK, countermeasures have been taken very late. The number of deaths getting down to 0 is expected not before the 12th of June. So in other words, 3 weeks later than in Germany, 4 weeks later than in Austria. And as a result of all of that, the number of deaths will be significantly higher in the UK in comparison to Germany. I would personally expect that the number of deaths in the UK will be significantly higher than in Italy and in Spain, even than in Italy and in Spain. In Austria, the countermeasures have been implemented early, and that will be reflected by a moderate number of deaths, only 500 deaths, and the whole thing will be over by the 6th of May. In China, we already have gone through the worst, and then in Sweden, you cannot calculate it, because in Sweden, we have the situation that as long as no countermeasures are taken, it is so that the number of infections will continue to grow exponentially. Now, if I come to the conclusions now, the virus can be eradicated in Europe in the second half of May, but only if lockdown measures will be consequently kept upright, or only if an alternative, smarter approach will be found. At least we need to continue to prevent the virus from spreading. In the UK and in the United States, it is not before the first half of June when this status will be reached. And as a result, as a consequence from that, we will observe significantly more deaths in the UK and in the United States than in continental Europe. Sweden's strategy to ban the virus is not successful. Korea's strategy was successful, but Sweden's strategy, a laissez-faire strategy like in Sweden, is not working. And if they don't take countermeasures now, they will have a continuing, exponentially growing number of deaths and new infections, and they will have a very critical situation with regard to their healthcare system. What we can also conclude from an economical point of view is that a complete lockdown by the end of May is economically very difficult to imagine, because we know from economists that each month of lockdown costs us between 3 and 5% of GDP growth. In other words, if we do the lockdown really for 2 entire months, then we are talking about a GDP decline of 8 to 10%, 6 to 10%, so an expectation 8%, which is very, very severe, which would imply a very severe number of unemployment, of additional unemployed people, a very critical situation. So therefore, we need to continue with rigorous measures in order to ban the virus until the end of May. But at the same time, we need to find a smarter approach than just lockdowning the economies around Easter. So we will have to open businesses at least selectively, significantly earlier than Easter. It is a very difficult situation right now. One can deal with it because we have to make sure that the virus is observed and measured and captured wherever it occurs. But we have to be very careful, probably for the rest of the year, until a medicine has been found. All right, ladies and gentlemen, thank you very much for attending. I see that there are many people in the chat, more than 400 people in the chat. I don't know exactly how I can answer some questions, but I'm very happy that I have a couple of people helping me, and probably they give me some information about what the questions are.
Thank you very much, Markus, for giving the presentation and for sharing your insights here. As you already mentioned, the participants have been asking quite some questions in the chat, and we tried to filter out some where there are, for example, a few questions which came up more often, and one of them is if the number of deaths is a good number to calculate on and compare between countries, because the countries are interpreting the numbers differently from each other.
Yeah, and I didn't get the question. If the number of deaths is the number, then?
The number of deaths is a good number to calculate on, as countries counting numbers differently.
Yeah, I mean, the database is one of the problems that we have. My assumption and my observation is that both death numbers and infection numbers are very biased and very different, and they differ very significantly across different countries. However, since the infection numbers are based on tests, and since obviously tests are taking place to a different extent in different countries, I consider them as a worse indicator than deaths, because deaths are less biased because not test-based. It is nevertheless so that that also death numbers are calculated and counted differently. So therefore, everything is not perfectly comparable to each other. However, data analysis is also the art of doing something and interpreting the data which you have. We are far away from perfect, no question about that, far away from perfect. However, if we compare the numbers in time, so if we observe them, that in Italy, for instance, death numbers are going down. In Spain, death numbers are going down. Even if you cannot compare the Italian numbers to German numbers, you can at least compare the Italian numbers to the previous Italian numbers, and that allows you to draw some conclusions at least. And one thing is clear, I mean, if nobody is dying anymore from the coronavirus, then the crisis is over. And that was a little bit my very naive approach, namely calculating when the last person has died from the coronavirus.
As you mentioned Italy and Spain already, one question went in this direction. How can we explain that Spain is expected to overcome the virus quicker than Italy, even though Spain has more infections and deaths?
What I've done is a trend analysis. In other words, we have a steeper growth in Spain, and we have also a steeper decline in Spain. I mean, one thing that we have to also observe is we are talking with exponential, we are dealing with exponential numbers here. In other words, the reason why the virus has so significantly been underestimated basically by everybody is because everybody didn't understand exponential growth, right? I mean, if you have a very small number of deaths, let's say below 10, and this grows by 50% every day, then you have 15 on the next day, and then you have 22 on the second day, and so on. In other words, nobody is doing the calculus what that means for the next 30 days. And one thing that I want to say is that exponential numbers mean that cases are going up exponentially, but it also means that cases are going down exponentially. So in other words, in Spain, numbers are going up even faster than in Italy currently, or maybe until 5 days ago. And based on the model, I would expect that numbers are also going down very much faster. In the sum, the number of deaths in Spain is rather worse than in Italy. But if you take those two effects together, but exponential development refers to both the phase where numbers go up and the phase where numbers go down.
Another question, Markus, that was raised a couple of times was the question about each country's capacity of intense care beds. So how does that come into play with your statistics?
Yeah, this is one of the numbers that I've calculated. And if you go to the conclusions again, so maybe I'll show you that here on this slide. If I go to Germany, so Germany, you can see there's one line which says maximum number of intensive care patients. So in Germany, I've calculated that as 3,763. That is the worst day of intensive care cases. Now we know that Germany at the moment has between 30,000 and 40,000 intense care beds. We also know that 80% of that capacity is needed for regular intense care patients, which means that we have between 8,000 and 10,000 intense care beds left, at least spread across the entire country, for corona cases. Now, if the maximum number is 3,700, then it seems as if Germany basically has enough intense care beds, even in the worst times. You might have followed that the president of the Robert Koch Institute 4 days ago said that he is not entirely optimistic that the number of beds is sufficient, but that it is possible that the number of beds is sufficient. Now, if you compare that to Italy, in Italy, the biggest number is very similar to Germany, 3,743. But the capacity of the Italian healthcare system is significantly lower. So in Italy, you probably only have 1,000 to 2,000 beds as a capacity for corona patients. And that means if you need 3,700 beds, which is already in the past, by the way, you see that 3,700 beds was the case on the 1st of April. In other words, Italy is already beyond the peak. But on that day, you did have a very horrible situation, namely that you had patients who would have needed an intensive care bed, but it was not there. And that is a very significant thing. The same thing holds in Spain. 5,144 is the maximum number of cases. I don't know exactly what the number of intensive care beds in Spain really is, but this number here would have to be compared to the capacity of the healthcare system. And by the way, this is the major reason why we are doing the lockdown measures, because it is clear that the healthcare systems are getting to the limitations of their capacities, and that has to be prevented. In Germany, I would probably expect that this will work. So in other words, the German limitation, the German capacity limitation will not be reached, but we know that this was not the case in Italy and Spain, and I'm absolutely sure that the UK and the United States will be beyond their capacity extremely significantly. So we are going to see really sad and terrible pictures, especially out of those countries within the next 3 weeks.
Another question, Markus, that was raised was whether you could comment on the relatively low number of deaths reported from China compared to the total number of cases in China.
Well, I mean, it can have two reasons. One possibility is they tested more than others. And to a certain extent, we know that China, at least in the Wuhan region, tested very, very extensively, just as Korea as well. In other words, if you test more, then you have more infections. And let's assume if the number of deaths is given, so to say, by a natural law, then the ratio of people who die divided by the number of people who have been tested or have been infected is clearly lower the more infections you have done. And the more infections you observe, the more infections, the more tests you have done. So in other words, it could be due to more tests. In Germany, we also have a significantly lower significantly lower death rate than in the UK. So in the UK, we have a death rate currently of 4%, in Germany of 0.3%, which does not imply that the English people are dying easier, at least not as long as the capacity limitations of the healthcare system are not reached. It simply means that the Germans are testing more.
I would add one question in the economy direction. What are your views on the economic recovery post-corona?
Well, I mean, that is a very difficult thing to respond to, because I mean, there are two theories, the V theory and the U theory. So far, at least the experts in the German experts council have claimed that it is rather a V than a U effect. Today, we have read and heard that at least in the automotive industry in Germany, they are more expecting a U rather than a V. Well, it simply depends on the question of how long this all lasts. I mean, if a significant amount of unemployment has been built up until the end of the crisis, which we are now observing in the United States, it is so that people don't have money for a longer period of time, and therefore we cannot expect a V effect. If the whole thing is going to be, I mean, if we would have a strategy after Easter in order to deal with the two challenges, namely the medical challenge and the economic challenge at the same time, it is quite good possible that it's going to be a V effect. So long speech, but in a nutshell, nobody knows at the moment. I hope it's going to be a V, but it is possible it's going to be a U.
Okay, thank you. And one question in the direction of the lockdown again. What do you think will determine when the lockdown will be released? What level should the number of infections go down?
Well, we have today been able to read that the Austrian Chancellor has announced that a partial lockdown lift is taking place after Easter. I mean, if the lockdown is just replaced by back to normal, it is absolutely clear that then the numbers will again exponentially grow, that we then will have a second wave, and that then we are not getting one step further ahead. In other words, if we go back to normal, we need to have a strategy. We need to have the strategy of how to deal with those people who are infected. It would have to be a rigorous infection strategy, a rigorous isolation strategy. It would have to be also a testing strategy, an immense testing strategy. The more data you have, the more reliably you can estimate. So in other words, you have two possibilities. One thing is lock down everything until the end of May. Then you can be comparatively sure that you don't have many people anymore who are infected, but it is an economic disaster. Or you can try to mildly start to reopen businesses after the Easter break, but then you need to have an isolation strategy put in place. You need more tests. You need tracking, by the way. You need to track the people because otherwise you are immediately getting into an exponential situation again.
So these measures you mentioned are among the smart measures for reopening to the reopening back business or something. Yeah. You were mentioning in your presentation.
Exactly. So those are the smart ways to deal with the whole thing. I mean, lockdown is effective but not very smart because you deal with one goal, namely getting the capacities of the healthcare system or leaving the capacities of the healthcare system high enough. In other words, you're trying to optimize a medical target function, but you are completely ignoring the economical target function. And smarter would it be if we would find a solution which allows us to optimize both, namely keeping the infection numbers down and doing business again. A lockdown is not smart with regard to that. With regard to that sense, it is effective medically, but it is also effective economically in a very negative sense. And I mean, I was starting with the different strategies that China and Korea have implemented. I think it makes a lot of sense to look at what Korea has done and to see what we can adopt to our European economies from Korea.
That was another bunch of questions on whether you could possibly also comment on some of the Asian countries' strategies to fight the coronavirus pandemic right now, and not specifically South Korea or China, but maybe Singapore or India, some of the Asian countries. A lot of people were interested in your view on that.
I mean, we are reading a lot about Singapore these days. I mean, India is clear. India is implementing a rigorous lockdown strategy. And given the population density and given also the degree of development of the country, comparatively low development degree of the country, maybe this is the only thing that you can effectively do. In Singapore, what we observe is Singapore is doing something rather comparable to Korea than to China or to India. But in these days, we see that the number of infections are going up again. So in other words, I don't know whether you have read the reports. So Singapore managed to keep the numbers comparatively low over days and weeks, unlike the UK and the US, for instance, and Italy and Spain and other European countries. But they do not get really rid of the virus at the moment. So if I interpret that correctly, Singapore is currently also thinking about implementing a lockdown measure.
And one very last question to you, Markus, as you are also Dean of WHU and so a leader in higher education and universities. So how do you expect the universities to go on in Germany? Will we have a proper fall semester or not?
Well, I mean, for me, the question is, how will higher university education continue in the future, and how will business schools continue in the future? I mean, there are a couple of things. One thing is that you observe that at least, I mean, if you take the best business schools around Europe, you see that all of them are still operating, at least on their degree programs. The executive education business and the international business is breaking down, logically, because nobody can travel anymore. But the degree programs are continuing because those schools have been able to manage the shift to digitalization comparatively quickly. One of the questions that I'm wondering is whether we will ever go back to a diversity strategy, globalization strategy, internationalization strategy, as it was the prevailing spirit before the crisis. Because I would expect that traveling will be restricted at least until the end of 2020. I mean, I cannot imagine that a large number of Chinese students will come to Europe or to the United States for studying in this year, and probably also not in the next year. So in other words, this is going to be very, very significant. This is going to be a very significant effect. On the other hand, I also cannot imagine that European students are going to will look for study places in the United States or in China to the same extent as they did it before the crisis. In other words, probably the business is getting, the university business is getting more local. So in other words, the opposite of what we all were trying to do over the last couple of years. And the other thing, the other part which is implied by your question is, how is that affecting other universities? I mean, not the business schools who are competing in an international scale, like us or like St. Gallen or like IE Business School, London Business School, whatever. What does that mean for German public universities? I probably think that students there are going to lose one semester because I don't think that those schools, also given the mass of students that they have, will be able to shift everything into a digital environment.